Thank you for joining us. We'll get started in just a few minutes. Hi again. We can see that people are still logging on, so we're going to wait a few more minutes before we start. Thanks again for joining us. Good afternoon. This is Tina Rhodes, and on behalf of the Policy and Community Relations Department at UNOS, I would like to thank you for joining today's webinar. If you're logged into the online portion of the webinar, please remember to enter your audio PIN, which appears on the right-hand side of your computer screen just beneath the phone number. Here are the objectives for today's call. We will present and discuss proposals on the non-discussion agenda for the regional meetings, review methods to submit feedback on proposals, and provide an overview of the regional meeting agenda for the winter public comment cycle. Today, we will review a public comment proposal and a request for feedback item from the Vascular Composite Allograft Committee. After each presentation, there will be an opportunity to ask questions. I encourage you to ask questions and provide feedback to help guide the committee. We also ask that you review the policy proposals, guidance document, and other public comment items currently open for public comment and submit feedback. They are available on the OPTN website shown on this slide and open until March 24th for comments. Regional meetings began last month, and we hope you are able to join us for your regional meeting. The primary function of the regional meeting is to provide members an opportunity to discuss proposed policy and bylaw changes. The feedback received during the meetings is shared with committees and the board for consideration. During the regional meetings, members also have the opportunity to hear an executive update on current OPTN activities, enjoy networking time with colleagues, and receive updates on committee activities. Proposals were distributed for public comment on January 22nd and are available on the OPTN website. The proposals placed on the regional meeting discussion agenda are presented, discussed, and voted on during the regional meetings. High-level overviews of the proposals are presented on a national webinar entitled Public Comment Orientation. We'll provide details on that new webinar at the conclusion of today's presentation. The proposals on the non-discussion agenda are not presented or discussed at the regional meeting, but a vote is taken on each to provide guidance to the regional counselor during discussions at the board meeting. Members may submit a request to move a non-discussion agenda item to the discussion section of the agenda. To do this, 15% of member institutions within a region must request that a particular item be moved to the discussion section. All requests must be submitted at least 1 week prior to the regional meeting date. If the 15% threshold is met, the item will be presented and discussed in the applicable region. Dr. Linda Sandalis, Chair of the Vascularized Composite Allograft Committee, will present today on behalf of the committee. The committee has both a policy proposal and a request for feedback item open for public comment. She will also share an update on committee activities. Dr. Sandalis will first present the policy proposal, update to VCA transplant outcomes data collection. Dr. Sandalis?
Thank you. Thank you for the introduction, and thank you for the invitation, and of course to everyone who has joined the webinar. We look forward to your feedback. Next slide, please. So I'm going to present and give an update on a couple of activities that we're doing. This first one, which is the update on transplant outcomes collection. The purpose is to fill VCA recipient data. We initially designed the forms to collect data several years ago when the field became under the final rule. And since then, we have seen inconsistencies in reporting the different outcomes assessments. And we would like to revise some of those forms to reflect a little bit more accurately what the different teams are doing and understand the outcomes a little better, which is one of the purposes of the goals of the OPTN. We also want to address the diversity of the VCA types in the waiting list. As you know, there are different VCA types, and they all have sort of specificities that we would like some feedback as well. Next slide. So just to give you a little bit of an overview of the VCA activity currently in the country, you see in your slide the different candidates that are on the waiting list. As you can see, in 2016, users started to become more active, and as you can tell, in 2019, the most number of patients on the waiting list are secondary to uterus. Nonetheless, face and hand continue being the most common VCA types. Next slide. In this slide, you will see the actual transplants that have been performed, which are consistent somehow with the prior slide. As you see also, in 2019, the largest number of people transplanted was also from uterus, both from deceased as well as living donors. Since 2014, which is when we became part of the final rule, or the final rule came out, there have been a total of 55 BCA transplants. Next slide, please. So our proposal is to modify the transplant recipient, the TRRs and the TRF forms, with the main goal to remove unnecessary data fields and to keep or add relevant outcomes to specifically 3 VCA types: upper extremity, head and neck, and uterus, and to request feedback on psychosocial assessment tools and also for outcomes measured for additional 4 VCA types. Next slide. We tried to briefly summarize data entries that we could generalize to all VCA types. So that's what you see under all recipients. These are going to be, or these are proposed to be removed from all the forms. Specifically to head and neck, it's going to be 2 outcome measures that are going to be removed, as well as from uterus. As you can see in the slide, these are, some that are not applicable to uterus, like topical immunosuppression, for example. Next slide, please. Entries that we would like to add are the ones that you also see in the slide, which are a little bit more specific to each BCA type, like some data on sensory for both upper extremity as well as head and neck, and some more specific also on uterus recipient, which is more OB/GYN related content. Next slide, please. So we would like to request feedback on a couple of things. One is on a psychosocial assessment tool. Currently, the forms include a short form of the SF-36, which, as you all know, is also included in other organ transplants. That is one option. Or the SF-12, which is just a shorter version of that, or a new patient-generated index, a PGI, which is more specific, has more input from the recipients, but is currently not standardized for all organs or for all conditions. Medical-related conditions. So we would like your feedback on which you think it might be better, or will provide a better assessment of the outcomes, or if all of them or none of them. So any feedback is very welcome. And then the second aspect is on clinically appropriated outcomes. We would like feedback on what you would suggest or recommend or think would be good outcomes for the 4 types of VCA that are listed. One, for musculoskeletal composite graft segments. This is, for example, a graft, a vascularized graft, for example, a transfer from the forearm to reconstruct tissues in a transplant, in an allograft setting, for abdominal wall, for larynx, and for penile transplant. So we would like to start collecting, some of our your feedback is to be able to measure outcomes on this type of VCAs. Next slide, please. So in regards to the implementation and the impact, we will people will need, or all of us will need to become familiar with the required entries by the OPTN. The transplant hospital staff will not only need, some of them need to be familiar with that, but also consider ways to collect that information, document that information, as well as coordinate if any of these entries or any of these outcome measures is different from those that the centers are collecting. Also coordinate a way to perform these if they are new, or and coordinated with all the others that they are collecting that are not required by the OPTN. This implementation is expected to await once VCA forms are in UNET, which currently, as you know, it is not in UNET and is a parallel process submitted directly to the OPTN. Next slide.
Thank you, Dr. Sandales, for your presentation. To ask a question, click on the hand feature on the right-hand side of your computer screen. We will unmute your phone line and call your name. Please remember to unmute your line as well.
So Dr. Sandales, the first question is from Joseph Hillenberg, and thank you, Joseph, for submitting a question. You can also do so in the question feature. He asks, the upward trend in uterus transplants is encouraging. I would guess that we would see phenomenal growth in this area. Is that what the committee is expecting?
Thank you for the question. I'm just going to paraphrase it to make sure that I understood it. So the question is, as the uterus and upper extremities are encouraging, is our expectation as a committee that we will see the same increasing numbers in other VCA types? Was that the question?
No, it's primarily about uterus and seeing this upward trend, and it's the expectation that we'll see further growth in that area.
Oh, I see. Well, so it is very likely that the uterus will continue growing. In general, one of the challenges that the VCA field is facing is the sustainability from a financial component, because they're still considered under research. So a uterus is not any different currently. It's also under research. So funding will be one of the variables that will be impacting the growth of uterus as well as other VCA types.
Thank you. Our second question is, how does the committee plan to use the data that is collected?
Yeah, so one of the goals is, once it is collected, at some point we would like to follow the path that other organs have taken, which currently, because of the low numbers, we're still not at par with the other organs. Like, for example, submission to the SRTR. We are not part of it yet because of the low numbers, but that would be a goal. Certainly, as our mission would be to analyze the data to get informed about outcomes and be able to modify policy accordingly and more specifically to each VCA type. So that would be also another goal, and of course continue refining data collection so that definitions of success and outcomes and safety and policy, it's more to how the field is developing. As you probably know, the data collection from the OPTN is basically, you know, what the current knowledge in VCA outcomes has. So it is important to not only be precise as much as we can, but also analyze it to be able to provide or inform safety and policy as we move forward.
If anyone else has a question, you can again use the hand feature or enter it through the chat feature on the right-hand side of your computer.
We do have another question. Have enough transplants been performed to know what data is actually best to collect?
That is an excellent question, and I think the short answer is no. In the sense that because of the low numbers, we're still trying to collect data that would provide insight into one, definitions of success, as well as standardizing. Still, the field has not, or there are not outcome measures that are specific for these type of transplants. So we are currently sort of paralleling these with tools that have been shown to be validated in fields like replantation, because the numbers in VCA are low to validate any tool specifically for VCA. So the collection of data by the OPTN it's really very helpful in that space as well. But and different teams also, in addition to the outcome measures that the OPTN collects, have also their institution specific outcome measures according to the research question or according to what the study team considers is important to collect. So that's where the development of the field is right now on phase 2 studies.
Thank you. We don't have any other questions right now, but I will remind everyone again to please visit the OPTN website and submit public comment online through March 24th. The next presentation is the request for feedback item, measuring transplant outcomes by collecting data on children born to uterus recipients. Dr. Sandel?
Thank you. So these, can we have the next slide? So the purpose of this is to, as you can see, pursue additional data collection to measure and evaluate uterus transplant outcomes. Currently, the OPTN is aware that there are 8 children that have been born from uterus transplant recipients in the United States. However, there's very limited data in these children that currently is also voluntarily submitted to the OPTN by the different transplant programs. The outcome of uterus is the birth of a child, and currently it is not possible to measure transplant outcomes without explicitly getting data on the outcome itself, which are children born from the transplanted uterus, which is the purpose of the transplant. So the committee has recognized the need to collect data at birth, as well as subsequent development of that child in order to assess the safety and efficacy of this type of transplant. Next slide. This is just a more granular information from our prior presentation about uterus specifically, as we were reviewing in our last talk or in our last presentation. Since 2016, the transplants of uterus have increased. Having said that, even though it's one of the highest numbers that are in VCA, you know, like as you see in 2018, there were 15. So even though the numbers are the most commonly in VCA, they're still very low numbers. In 2016, there were 6, and you see the distribution of deceased versus living donors, and in 2019, a total of 12. Next slide, please. So in terms of the scope, is similar. We would like your feedback as well as the timing of data reporting and how long, for how long. So next slide. We, as you know, collaborate with the committees within the OPTN, and that includes the Ethics, Data Advisory, and the Pediatric Committee, as well as similar, and we're accustomed to in the OPTN, reach for subject matter experts to stakeholder organizations, which are those that are listed in the slide. Slide. So currently, teams are voluntarily on the different things that you see. You know, when was the neonate seen by the program last? Complications at birth. It's very general. You know, yes or no. The weight and the APGAR, which is a standardized measured. Possible additions could be length of the child and the length of stay. We would like feedback into which other that would be helpful or should be included. So next slide, please. We in the committee briefly passed birth for developmental milestones, for example, from the CDC, from the Center for Disease Control and Prevention, for assessing well-being, which starts at 2 months and progressed to 5 years. Also, feedback for how long be collected, recognizing also by the committee the possible logistical challenges, including, you know, the pediatricians who provide the care for the children that may not be associated with transplant hospitals, or it's also been mentioned that there might be challenges in the quality of data submission. It has also been brought up in the discussion. The mothers are actually, you know, could collect information and send it directly to the transplant center without necessarily going through a pediatric place currently. So just to finish with this point, feedback in any additional consent or regulatory aspects of this
Click on the hand feature on the right-hand side of your computer screen.
And he says, has the committee seek input from a neonatologist for relevant metrics to follow, and for how long?
So let me just see if I understood correctly. So currently, we don't have any measures except for at birth, but it's already being conducted children in general, and to apply those to children born after. I just want to stop here and just
Yes, and actually I'll go ahead and unmute his phone line.
Thing, you know, with like the advent of new babies, stuff like that, were there characteristics that we could use as comparative metrics that people were following on with some of these children that is potentially comparative data? And is a community that takes care of these babies, the neonatology groups, or have things that they might treatments resulted in success?
Yeah, that is a really good point. And to engage it also and the date the child is born, and then after that the IVF community has for their for comments was to then you need to be modified later, but I think I appreciate that question, because yes, it is a concern, and always perhaps going to in the face of the unknown, collecting the more data in a systematic way will be probably the best route that will knowledge.
Thank you. We don't have any additional questions at this time, but now Dr. Sandallis will present an update on VCA committee activities.
Thank you. So yeah, I wanted to we wanted on behalf of the committee to just give you a couple of updates, which is what is going to be implemented, and we have 2 slides for this. So just following sort of the initiative of all other organs in terms of elimination the use of regions in VCA. The decision was to start with candidates within 5 months in May of 2020. The other 2, next slide, the other 2 implementations that will be coming up the following year, the membership requirements for a little bit of a little background on this, for not only the program, but also the requirements for key personnel. The list of body parts basically is under the definition of VCA currently. There are different areas that when these becomes implemented would be part of VCA, which is not only the ones that are more commonly done, like upper extremity and head and neck, but basically also other organs or type of transplant that are transplanted with the vascular supply. For example, if a center wants to do a vascularized spleen for a specific, so that would be also considered part of VCA. The additional 8 covered body parts, as you see in the slide, it's on the website and can be accessed through the website if somebody wants a little bit more granular information of what it will be considered VCA when it's implemented in June of next year. Thank you.
Thank you again, Dr. Sandallis. We'll pause here. If anyone has any questions about the committee updates or the previous segments, please submit them through the chat section or use the hand feature on the right-hand side of your computer. We'll give it a couple of seconds here. Okay, we don't have any questions. So once again, thank you, Dr. Sandallis, and thanks everyone. The proposal is open for public comment. This slide contains a screenshot of the public comment page on the OPTN website. You go to the OPTN website, click on the Governance tab at the top of the screen, and choose Public Comment to access the proposal. While you're on the OPTN website, regional meeting information is located on the Regions page under the Members tab. The list of regional meetings, click on your region for details, including location, meeting materials, and additional regional information. We hope you'll join us for our final public comment orientation webinar on Monday, March 9th at 2 p.m. Eastern. This new webinar provides an orientation to the public comment process, and a high-level overview of proposals to be discussed at regional meetings and helps prepare attendees for the regional meeting. That concludes today's webinar. You can find complete webinar details, including links to register and recordings of past webinars page under the Learn tab on the OPTN website. All national webinars are recorded, and links to the recordings are posted on this page within a few days of the webinar. Thank you again for joining us today, and we look forward to seeing you at your regional meeting.